Okay, I'm Megan, I'm gonna do my NG pass off. So first I'm gonna check the order, make sure that this patient actually does have an order for an NG tube, which she does. And so I'm just gonna do some hand hygiene. I'm gonna gather all my supplies. So I just need to grab a couple pairs of gloves and then my other supplies are over here. So I'm gonna pull these to my patient's room, knock on the door. Hi, how are you today? Good. My name is Megan and I'm going to be your nurse, okay? Can you verify your name and date of birth for me? Perfect, that's exactly what I have on my papers, okay? I'm going to close the curtains around you, close the door, give you some privacy, okay? Do you have any allergies that we need to be aware of? No? Okay, good. So what I am coming in to do today is place an NG tube. I've heard you've been having some issues with your bowels, and so this will just help to kind of clear that up, okay? Yeah, it will be uncomfortable for a little bit, okay? It won't feel great, but it should help once it's in place. It should help a lot. It should give you some pretty good relief, okay? Yeah. So what it's gonna do is we're gonna put it up your nose, it's gonna go down your throat, and then it's gonna go into your stomach. And then we're gonna attach it to a suction, and that's just gonna kind of try and break up whatever is in your stomach, okay? Okay, so we're gonna raise the bed to a comfortable working height. And then after that, I'm going to raise her up to 45 degrees, whatever she can tolerate, or high collars. If she couldn't tolerate sitting up, then we could lay her down flat and make sure to cover her with a drape and just to give her and then we insert the tube that way. So I have my supplies. I'm going to put my gloves on. Do you have any questions before we proceed? No? Okay. Alright, so I'm going to put on my gloves, put all my supplies out. Water. I'm going to attach my vent to that right now. I'm going to attach this to my suction. So that's ready to go. Okay, and then I have my drape. We're just going to put this drape across too, okay? And then I would also make sure that I have an emesis basin or some tissues because it could cause them to throw up or it could cause their eyes to water. I'd make sure that I had that with me, but I don't, so we'll just pretend. I'm gonna get my tape ready. I'm gonna get 3 pieces of tape. The last one I'm gonna split in half at the bottom. Okay, so what I'm going to do now is I'm going to measure. So I'm going to make sure I measure it from nostril to the tip of the ear. It's about like that. And then I'm going to find my xiphoid process, which is about right here. And then we're going to go just a little bit further, or a little further than that, depending on company policy. Sometimes they like you to go a couple of centimeters lower than what the xiphoid process is. So we're going to go about 53 centimeters is where we're at. Okay, so I'm going to put a mark on that. Okay, and then I would normally do a lubricating jelly, but for this, we would lubricate 2 to 4 inches. This one's going to be a spray. Okay, so what we're gonna do is I'm actually going to hook these up together just so that it doesn't leak. Okay, so what we're gonna do is first I need you to tell me, do you know which nostril you can breathe out of better? You've never tried that before? Okay, so you're gonna take your hand, you're gonna cover this one and then breathe in. Okay, and then cover this one and then breathe in. Okay, so the right one is the good one? Perfect. That's the one that we will do then. Okay, so what we're gonna do is it's gonna go into your nose, and then when it gets about to your pharynx, I'm gonna give you a cup of water and you're gonna start swallowing sips of water to help it go down, okay? Yeah, it'll probably make you gag, but it'll feel better once it's in. Okay, all right, you ready? Okay, here we go, 1, 2, 3. Good, 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 good. Okay, make it to the pharynx and then start drinking some water. And if at this point, if they got to the point where they were gagging or it just fell off, it's gonna feel different, but if it fell off, we would check with a tongue depressor, make sure there's no coiling in the throat and that it's all going down smoothly. Okay, here we go, ready, sips. Okay, and when we first start, we wanna make sure her head was in the pillow, but once it gets past the pharynx, we wanna make sure that her head is leaned forward with her tinge tilted forward. Okay, so with this particular mannequin, it only goes to about there. Not quite to my mark, but normally I would put it up to my mark. So then I would tape it to her cheek. Which it doesn't really want to stay, so if it did stay, then it would be taped for a minute. And then I'm going to check for gastric juices to make sure that the placement is correct. Helps that there's a lid on it. Okay, so I'm gonna pull back 5 to 10 mLs. Okay, I got some gastric juices coming out. And then I would put it in here. I would check my pH of it. Okay, less than 5.5, so we're good. I'd also check the consistency and color of it to make sure that it's what it needs to be. And then after I checked for gastric juices, I would then have the x-ray tech come in and check to make sure that placement is right. If placement is right, then I'm going to attach it to the bridge of her nose. My little tape right here. Wrap it around the nose like that. Okay. And then I would have her turn her head to the side to give her some length. And then I would attach it to her gown. So I'm gonna grab my other piece of tape. Tape it like that. Grab a safety pin. So if at any point during this procedure the patient started turning blue, felt like she couldn't talk or hum, and it was causing a lot of issues with breathing, then I would want to pull the tube out immediately because it probably means that the placement is into the lungs, and we don't want that to occur. So that's what is very important about checking placement of the tube. But I noticed that it was in the right place. We double checked with x-ray and it was all good. So then I'm going to hook it up to suctioning. So I'm gonna make sure I pinch it off so that gastric juices don't come out. Okay, hook it up to suctioning. And then we want to put it on regular and intermittent suctioning and make sure that it's there and that it's working accurately. And then after that, I want to make sure that I come in and check on my patient every 2 to 4 hours. I perform mouth care, I perform lip care, so put chapstick on them just to keep them comfortable, make sure that their lips aren't getting chapped, and to make sure that everything is okay with them. And we're going to lower her back down and get her into a comfortable position. Okay, how's that? Is that okay? Okay, are you comfortable? All right, good. And then after I would do that, I would make sure that I document any findings that I found, any abnormalities, how she tolerated it. I would remove my gloves and I would perform some hand hygiene. And then I would grab all my supplies and take them out of my room, make sure that the bed rails are up, make sure that the patient is happy and taken care of.